So these are the Cialis 5mg daily, Tadalafil 5mg daily, FAQ, frequently asked questions, with Gil T back for this video. Welcome, Gil.
Thank you, Stephen.
This is the TRT and Hormone Optimization YouTube channel, and if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way. So we're treating here the questions that were commented under the last video we did. The link to that video is under this one in the description. So the first question, I use 10 milligrams on every alternate days. Is that also a right strategy?
Well, so Cialis tends to have a half-life that is significantly longer than some of the other PDE5 inhibitors like Levitra or Viagra, also known as Vardenafil, Sildenafil. So with Tadalafil, you technically can use a slightly larger dose at a reduced frequency like an every other day approach. This will have no different than when we're using testosterone cypionate and we suggest a twice a week over a once a week protocol. This will come close to, dipping a little below the half-life and then re-upping and dipping below and re-upping. So rather than going from, say, a 100 to 75 or 80% of the half-life back to 100, you're going to go from 100 to about 40 back to 100. So if you had to graph this out over the long term, the peaks and valleys will be slightly bigger, and therefore your average steady state will have a slightly less linear curve. This does not mean with a medication like Cialis, which is generally intended to be used on a daily basis for other health benefits, this is a little different than using a hormone, which can have other implications of fluctuations. So the fluctuations of Tadalafil specifically are going to be just fine with an every other day dosing by doubling up on the dose. There is one thing to point out. Some people are dose sensitive, and I know this is probably one of the questions that's going to come up later in this video. If you are dose sensitive, no different than using elevated doses of a hormone, using a slightly elevated dose of Tadalafil can increase the potential side effect or unintended effects of that medication. So if you want to mitigate some of those, you may do a little bit better on a lower dose. And if you still need a larger total milligrams in a steady level, then increasing your frequency is the best way to achieve that.
Okay, next question. I started using this very recently at 2.5 milligrams daily, just to ease into it. Is this a worthwhile dose, or does it really need to be minimum 5 milligrams?
There is no minimum. It's worthwhile because the minute you put a medication into your body, it's going to begin to work, and it's going to go to work for you on the intended action. And again, the unintended actions are going to be there as well. And as with most medications, this is going to be dose dependent. If you are hypersensitive to a particular compound, then 2.5 milligrams for you specifically may have the same efficacy level as 5 milligrams for someone who is not as hypersensitive to that compound. So you really have to find your own individual approach, which again is why anything in medicine is not a one-size-fits-all approach when it comes to optimization, because the intended effect for one person may be different than the intended effect for another person, and the dose requirement for that individual may also differ from another individual. So if 2.5 milligrams gives you your desired effects over the course of time, then it is certainly not an unworthy dose. If you feel that you need more and you're able to tolerate more, then you can give that a shot. It's never a bad idea when beginning something new to start at a minimal effective dose and then titrating up, because it does prevent the potential risk of having to back off and give it time, or worse, dealing with a negative outcome.
Mm-hmm. Is there a specific age one should be before considering Tadalafil?
First, you have to ask yourself, do I need it? Because it is a medication, it is a prescription medication. And even with supplements that are unregulated or over the counter, anytime you're going to put something in your body for this, intended purpose of metabolizing and gaining some sort of a benefit, you may also have to deal with an unintended effect. And therefore, you have to ask yourself, what is the risk-reward ratio? And while it is minimal with this specific medication, there are other aspects that I think we'll get into in upcoming questions, which may have some implications. And the question again is, do you need this? And if the answer is no, would I tell a 15-year-old or an 18-year-old to go ahead and get on daily Tadalafil? Probably not, unless there was a specific need. Now, as we tend to age, and I say we, I'm referring to men, as we tend to age, our need to alleviate some of the symptoms that Cialis or Tadalafil can alleviate or relieve for us begin to increase with aging. So that age isn't specifically a number, it's more of a biological marker of when these signs and symptoms begin to present. And this is an individual decision yet again, and it's up to you to decide, can I benefit from this? And when is the right time to approach it, at what dose, frequency, etc. Some of the most common ones, as we know, is blood pressure, the prevention or inhibition of BPH, which is benign prostatic hyperplasia, which is a multiplication of prostatic cells, which causes an increase in prostate size, which effectively will press on the bladder and on the urethra, preventing you from urinating properly and fully, and it can also cause the thickening of the bladder walls over time. So this is something that tends to happen in most men later on in life. However, some men, due to various causes, whether it's blood pressure, whether it's androgen use or genetic predisposition, may experience BPH at a younger level. So again, the question is, why do you need daily Tadalafil? And it's not really a number. It's more of, can I benefit from this today? And what are the downsides of doing so?
Mm-hmm. Does very low dose Viagra work the same on the vascular system and prostate?
In short, yes on the vascular system, no on the prostate. In long, the main differences, they're both the same class of medication. They're both PDE5 inhibitors. They both allow the smooth muscle of the endothelium to essentially relax and vasodilate. This does not directly work on the prostate. This works on preventing one of the key aspects that causes BPH. Therefore, it'll slow it down and possibly help reverse it. That is an indirect effect. It does not directly have a mechanism to shrink the prostate, okay? We do know that acute stress, especially recent and ongoing stress, is one of the mechanisms, and I recently read a Harvard study that stress is a big factor in BPH, and one of the mechanisms on that, I believe, is the sympathetic nervous system acting, and we know that that has a dramatic effect on cortisol and adrenals, and this also ties back into BPH. However, blood pressure is another one, and if you can reduce this, then this is something that can help. But you got to remember that Viagra, or sildenafil specifically, has a far greater effective time in the body, far quicker to excrete, and a shorter half-life. So I often refer to, with patients when they ask the difference between Cialis and Viagra, think of them as both punches, but the Cialis is a jab and the Viagra is a left hook. The left hook is a knockout punch. It's powerful, it's quick, it hits, it's gone. The jabs can keep coming and coming and coming, and they have a softening effect on your opponent over the course of time, but you need more of them more frequently. So will one do the same as the other? No, not exactly. Otherwise, they would be redundant. Viagra is more indicated for specifically erectile dysfunction. While yes, it will cause vasodilation systemically, it does come with potential risk for elevated side effects, such as sinus pressure, headaches, etc., because it does happen to cause more pooling of the blood in the head because it is that much more powerful. It's also often dosed at far greater doses. A standard name brand Viagra, I believe, is 100 milligrams, while some of the generic compounders make 125 or 150 milligram tablets or capsules. And this is essentially intended to give you that left hook effect, whereas the Cialis is often dosed at 25 to 40 milligrams when it's prescribed for erectile dysfunction, or as we're discussing today, 2.5, 5, or 10 milligram doses for daily maintenance. So do not think that taking 10 milligrams of Viagra is going to equate to taking 10 milligrams of Cialis.
Mm-hmm. Can Cialis cause dizziness?
It can. There are specific people who are already taking blood pressure medication whether they're ARBs or whether they're, different classes of medications that are specifically for ACE inhibitors or whatever the case, even diuretics. If you're already lowering blood pressure, you're going to have a polypharmacy effect. And this simply means that you're taking several classes of medications at the same time for the same intended outcome. So Cialis is known mildly, again, dose dependent, to vasodilate. So if you're running fluid through a hose and you're running the same volume of fluid through this hose, but you're now increasing the diameter of the hose, the pressure in that hose is going to be reduced. And when the pressure is reduced, but the pump continues to operate at the same level, the circulation or the flow will be slowed down. And when that happens, then you may experience dizziness and lightheadedness when you go to stand up, because the amount of oxygen coming to the brain and the amount of carbon dioxide being removed from the brain via the veins is going to be slowed down as well. So when you need a vast amount of oxygen, such as physical activity, from a state of rest into a state of carrying load, this can cause dizziness. Yes, that is one of the common side effects. And again, it's going to be compounded with a polypharmacy effect. So if you're already taking blood pressure medication, be cautious and make sure that you speak to your provider about any potential contraindications. Nitrates, nitroglycerins, and those class of medications are totally contraindicated to PDE5 inhibitors, and this is one of the main reasons for it. If you're taking a weaker class of drugs, then again, consult with your prescribing physician. And this is one of the reasons why I always cringe when I see guys online saying, oh, you don't need a prescription for Viagra sales, just go on this website or go on that website. Understand that there's a reason specifically, and I'm not here to say that every single prescription drug is just and ethical with regards to its ability to obtain it. We already know that certain hormones should not be scheduled, but this is more of a political move. With PDE5 inhibitors specifically, they do have contraindications that can be serious, and it is important that you have a follow-up and a proper assessment with a provider to diagnose and be able to prescribe something, because if you take this on your own and you do have something that is antagonistic, you can cause harm and in a rare scenario, or even death. So be very cautious in buying these compounds online, because A, you don't know if the compound is legitimate and if it's what the label says. B, you don't know the dosing on it. And then C, you don't know if you happen to be an individual that should not be using this compound. So by circumventing of this medication, you are taking dramatic risks. So be very cautious with this.
Okay, next question. I get a headache with 5 milligrams. What other side effects are there?
Get a headache with 5 milligrams. Okay, try dropping your dose or try dosing less frequently. Again, this brings me back to the initial question earlier. It is extremely dose dependent and it's extremely individualistic. Every person responds differently to medication. Now, while Tadalafil is not specifically one of those common headache causing medications like a Viagra, it is certainly one that has that potential for the same reasons. The more common reason is pooling of the blood in the lower extremities, or particularly the areas where you tend to train a little bit more. So lower back pain from blood pumps, leg pain from blood pumps is a lot more prevalent in Tadalafil, whereas Viagra is a much faster acting, more powerful medication, and that tends to pool blood more in the head and sinuses. So if you're suffering from headaches from Tadalafil, again, the first course of action would be to drop your dose, run with that, see if it works for you. If it does, great. If it does not, try to dose a little less frequently, because you do have the luxury of a longer half-life with this medication. If ultimately you find that the reward is not as sufficient as the side effect and you're unable to alleviate the side effect, maybe this is not the class of medication for you.
Okay. How much time before a workout do you suggest taking it as a pre-workout?
If you're using this at a frequency that allows you to build a level steady state, as we suggest, then timing is no longer relevant to your training specifically, because you're going to have a nice systemic effect at all times. And this, again, would differ from a Levitra and Viagra, which are fast-acting, fast-excreting, to a Tadalafil, which is long-acting and long-sustaining for a steady state. So with Tadalafil specifically, On moderate doses, you don't need to time this with your workouts. If you're using it as a pre-workout for the vasodilation effect, then Levitra and Viagra are going to have a much more powerful punch in that regard. But again, precautions, as I mentioned earlier, because they can have other implications with other drugs or supplements, including a lot of the pre-workouts that may contain arginine or carnitine or any other nitric oxide producing effects. So be cautious, especially if you're susceptible to dizziness or lightheadedness.
Someone else asked, if there is a 36-hour half-life, why not take it every other day?
I think we addressed that in an earlier question. You know, every other day would put you at best at a 48-hour, and that would drop you into that 40th percentile of the intended dose, as opposed to dropping you into a 75% or 80%. So if I give you a curve that looks like this and I ask you to draw a line in the middle, that line will be lower than if I give you a curve that looks like this. It's just more peaks and valleys. And again, if you happen to handle it this way better, or your adherence level is better, or you just happen to have a capsule that is undividable, you happen to purchase capsules and they're 10 milligrams and you cannot break them up. And it's a matter of, do I take 10 milligrams a day or 10 milligrams every other day? Certainly you could start with 10 milligrams every other day and see if that works out for you. But frequency is one of those dependable variables that you have in your tool belt to allow you to get the most efficacy out of your protocol. And it shouldn't be a fixed, it should be a variable that you can adjust according to your needs and outcomes.
If I use it for more than 1 week, I get cold or flu-like symptoms, side effects. Does it really weaken the immune system?
It does not have any direct mechanisms that I'm aware of to specifically weaken the immune system. Your immune system is fairly complex. You have dendritic cells, which are an epithelial tissue, both on the outer layers of your skin, as well as in mucous membranes like the esophagus, lungs, etc. That is your first layer of defensive immunity for your body with cells, infection antigens, with antibodies. The antigen is the pathogen. You're going to be met with antibodies that are going to be responsible for your overall systemic immunity, and this also includes the lymphatic system. So layers of immunity are fairly complex, and it's not something that's going to be inhibited by a vasodilation effect. If you feel certain that this is a legitimate sickness, perhaps look into possible infections. And if you feel that this is not sickness, but something that maybe your body's responding to, perhaps you're having an allergic reaction. Either way, I would recommend a follow-up assessment and try to rule it out specifically. Oftentimes, people are quick to put a finger on something because it is one of the recent changes they've made that they're the most alert of, but then they don't realize that other changes took place. These can include nutrition, sleep, exercise, stress, changes at work, changes at home, changes in psychological or mental health. And there's so many factors or variables that go into your daily life and how you feel. And quite often we just put a finger on that one aspect that we're most excited about. So you can use a process of elimination and determine if it's truly the cause of your symptoms or if there are other underlying factors involved. But in short, directly, I do not believe that Tadalafil is going to have any effect whatsoever on your immune system, not for benefits and not for detrimental effects.
Agree. Does Cialis influence nutrient partitioning?
No, it can improve the desired. See, when a person uses the term nutrient partitioning, we have to assume that they are concerned primarily with body composition, training, and the outcome of their physique, because only bodybuilders and physique guys are going to use nutrient partitioning. So if you're asking that question, I'm going to go out on a limb and assume, without being able to ask you a question in return, that you're concerned with how this is going to improve your overall look. So we have to consider the fact that it's going to boost nitric oxide, and it's going to boost circulation, and it's going to reduce blood pressure. All of these things are extremely beneficial to your plasma or the efficacy of your blood to be able to move nutrients into your cells. So Will it improve nutrient partitioning? Indirectly, yes. Directly, no. It is not going to change your metabolism. It is not going to change the anabolic and catabolic effects of metabolism or how your body moves or excuse me, how your body uses nutrients. It will affect how efficient your body is at moving these nutrients to where they're needed. So you got to be cautious in saying this will have a nutrient partitioning increase or positive effect, but it may have an indirect one. Look, everything we do is going to have an intended effect and an unintended effect, and we always have to weigh what these effects are. And one of the effects of better circulation is the ability to deliver things better to where they need to go, and also clearing things out of the body better accordingly. So indirectly, it might. I wouldn't worry about it too much for that regard. I would just make sure that everything else is optimized first. And when it comes to nutrient partitioning, make sure that you're taking in the correct nutrients at the right time, at the right doses. And that's going to do you a hell of a lot more for your overall physique than just adding in a Tadalafil.
What's the approximate cost of the orally dissolvable Tadalafil per month, and is it available as a generic?
Well, it's only available as a generic. Tadalafil, okay, so Cialis is a name brand. And Tadalafil is the raw ingredient in Cialis, and that is the generic version. So generic makers or compounders of a medication cannot use the name Cialis. They have to use the name Tadalafil because it's trademarked. So any compounded medication by definition is generic, because if it isn't compounded by a pharmacy, it is made by the big pharma, and then it has got the name brand. So all Tadalafil is generic. With that said, the ODTs are, or as we label them ODTs, they are essentially called orally dissolvable tablets. These are compounded by pharmacy that we use in our clinic, and the average cost on them, and our patient counselors handle the financial aspect, but I do know off the top of my head that they range less than $100 a month for a daily dose. So even guys that are taking, and the way we get them is 25 milligram tablets, and they are scored into an X, so you could break them in half or into quarters. And if you break a 25 into a quarter, you're ending up with 6.25 milligrams. The nice thing about the ODTs is that they do not require any water. You can put them under your tongue and they dissolve fairly rapidly. In fact, I have one if you'd like, I'll show you. They come in a 10-pack, and a 10-pack will give you 40 tablets, which is better than a month's supply. So it'll last you 40 days for a pack. And if you take a look, they come like this, individually wrapped in this little foil. You just put this in your pocket if you need, or if you're traveling, and then you take them right out of the foil. And if you take a look, you could see that they're scored with an X. And they literally just break in your fingers like this. So I broke it in half. And then I take the other half and I break it into a quarter. It goes under the tongue. And with about 5 seconds, it's pretty much already dissolved. You would tend to hold it under your tongue for maybe another 30 seconds, allow it to absorb. And it's in systemic circulation, and you could swallow the rest. You're bypassing the GI tract. You're bypassing the first liver pass, which destroys a big efficacy of most medications. You're bypassing the need to wait in line when you have steak, potatoes, and a glass of wine in your stomach. And you're getting a much more rapid response from this medication. So to me, the ease of use, the lack of necessity for a glass of water to swallow a pill, the fact that I could throw this in my pocket when I go out or go on vacation, just makes it so much easier. And the fact that it works when you need it to work and you don't have to worry about eating or drinking is a no-brainer. So we love these, patients love these, and they're available by prescription to any of our patients, including our telemed patients. A lot of our TRT guys love these because when they order their testosterone refills, they usually say, give me 3 or 4 months of ODTs, and they ship together in the same box.
Mm-hmm. Last question, Gil. I read that back pain is a class effect across all PDE5 inhibitors. Will my back pain get less over time?
So you got to remember, as we said earlier, the back pain is essentially a pooling of blood creating a pump. Now, why is it lower back pain specifically? When you're standing, most of the time, your spinal erectors in your posterior part of your core are essentially designed for pulling your torso up, or what we call opening the hip in conjunction with your glutes. So your glutes, your hip muscles, your your hip flexors and your spinal erectors together open and close the hip joint. And when the hip is at full extension, a lot of the pressure there, even though you don't think about it or realize it, is contracting of the spinal erectors. And when the contraction is nothing more than shortening of the muscle. When you lean forward, your spinal erectors are stretching. This is what we call the eccentric phase. When you're standing upright and your hip is open, your spinal erectors are contracted or shortening, which is what we call the contractile phase of a muscle. When a muscle spends a lot of time in the contractile phase, and if you broke down a muscle tissue from a side, like a lateral cut, you'll notice that there's a lot of different parts of the fiber that are responsible for contraction. And when it's contracting, it's essentially using up energy. And the more energy it uses, the more oxygen it requires. And the more oxygen it requires, the more blood flow is required. And when you're holding a contraction for a long time, this is why we get this blood pump that feels good in the gym. But when you're doing this for long periods of time, you know, guys that are standing on their feet for 8 hours and they say, oh, my lower back hurts. Well, because your lower back has been in a contracted state. Now, while this is a relatively fast twitch muscle, which is responsible for constant motion, okay, it is also one that over time will get tired. Now, more blood pulls in there, the more pressure you're going to feel. And that pressure, or that blood pump, is essentially what you're calling back pain. And this is why massages and hot and cold compresses help to move blood in and out of the area and break up that tissue. So will back pain go away? Put it this way, the better shape you're in, the more you can delay the onset of this pain. So what I recommend for guys that constantly suffer with lower back pain is work on strengthening your posterior chain. Start by learning proper movement. Light loaded exercises or deloaded exercises like good mornings and deadlifts and anything that has to do with hip hinges or even light kettlebell swings, anything that will strengthen your glutes and your lower back is going to help you delay the onset of lower back pain, because you're going to condition your spinal erectors and your core and your posterior to sustain loads. And when you're deloaded, it's going to be a piece of cake. So a lot of it has to do with deconditioning and a lot of it has to do with adaptation. But if you feel that the artificial vasodilation effect of allowing blood to get in while you're deconditioned is causing you pain, back off the dose a little bit. If it continues to progress, back off completely. Work on strengthening your core and posterior chain, and then try again in a couple of months.
Awesome. Thank you so much, Gil, for answering all our viewers' questions. I think it will be highly appreciated. Thank you so much.
Always a pleasure. Thanks for having me again.
Now do this next. Click on one of these thumbnails to learn a ton more about TRT and hormone optimization.
It doesn't matter what you think.